Good morning, everybody, and welcome to this joyous occasion where we're celebrating Foster Care Week and the wonderful contribution our carers are making to the lives of our precious and vulnerable children. My name is Samantha Hauge, and I'm Chief Executive Officer of the Foster Care Association of Victoria. Welcome to our Carer Celebration and Annual General Meeting. I acknowledge the traditional custodians of all lands from which we join together today. I recognise the Wurundjeri people of the Kulin Nation on whose land I now sit, and all First Nations people, their land, their connection to land, sea and community. And I may pay my respects to all Aboriginal people here today and elders past and present. Foster Care Week as a concept was started by the FCAV probably around 15 years ago to celebrate and advocate for carers, and is now grown into an annual statewide event which celebrates and raises awareness about foster care. Now with media, agency and government buy-in, Foster Care Week gains more momentum each year. It's been a wonderful action-packed Foster Care Week so far, and it's so good to see so many of our carers here today. Before we begin, just a couple of housekeeping rules. You'll see a Q&A section on your screen, so please feel free to post any questions you may have. We will certainly attempt to answer those questions in real time, or we may need to refer them to an appropriate source, but we will get an answer to you either way. There is also the general chat function, which most of you will be familiar with, which you can use to post comments as we go along if you wish to do so. And for all of our members here today, I urge you to stay online to make sure you give your votes at our annual general meeting segment, which I do promise will be short and sweet. We also have some Coles My vouchers for all of our carers who have registered to attend today as a token of celebration and appreciation for all that you do. We'll send them to you via email over the next couple of days, so please keep an eye out in your inbox. It's now my absolute honour to introduce our elder Uncle Colin Hunter, who is a proud Wurundjeri man, to conduct a welcome to country. Thank you, Uncle Colin. Sorry, everybody. I understand that Uncle Colin has not been able to join us at this stage. So I will take this opportunity myself to say a few words, with this year's theme being about caring through COVID and the changed care environment. As I said, thank you so much, everyone, for joining us. And this is now our second online carer celebration. And who would have thought that 18 months ago, our world would look so different? With the events that have taken place both in Australia and overseas, it now just seems absolutely incredible. The pandemic has been a truly epoch-defining event for all of us. And I know for many of you, and from my own personal experience, that this last lockdown has been particularly challenging. Over the past 18 months or so, many of you have become teachers, 24-hour nurturers, facilitators of online contact, solely responsible for the social, physical and emotional well-being of the children and young people in your care. You've done all of this under the heightened anxiety of a major health crisis, and many of you have faced financial and isolation pressures. And this has been made particularly hard as we face the reality that dealing with the Delta variant now means that daily life is unlikely to return to any sense of normality soon. In thinking about the upheaval that we've all endured in the past year and a half, I'm reminded of the words of Charles Dickens in A Tale of Two Cities. It was the best of times, it was the worst of times. It was the age of wisdom, it was the age of foolishness. It was the season of light, and it was the season of darkness. I think that these words really capture the duality of the situation that we find ourselves in today. That the pandemic has been a social and economic crisis is unarguable, but has also come with some innovations and adaptations, which in the longer term are likely to be revolutionary. For example, the advent of the online meeting platforms such as Zoom and working from home have the potential for far-reaching social and economic consequences. However, in dealing with these longer-term consequences of the pandemic, it will require an effective funding model that supports carers and children to access the essential services that they require. The difficulty from a carer perspective is that the pandemic has been a crisis within a pre-existing crisis. Dealing with the pandemic has occurred in the context of a child protection system that was always in part dysfunctional, with many of the carer support arrangements in urgent need of reform. To its credit, the department recently commissioned the carer census to find out more about carer attitudes about the current child protection system. And while the results of the survey are not surprising, it nevertheless is still confronting to see and hear the depth of carer concerns and the frustrations which are revealed by the statistics. The good news is that an astonishing 97% of foster carers agreed or strongly agreed that they felt confident in their personal ability to provide care to the child or children in their care. This amazing finding speaks to the personal qualities of foster carers, and in particular, the capacity of carers to provide care to children, care to needs of children in difficult circumstances. But the findings of the survey also tell a story of the poor treatment that volunteer foster carers often receive from the government and the toll that this takes on their personal finances, mental health, and attitudes towards caring in the future. For example, 75% of foster carers report that having a child in care has had a negative impact on their finances. 59% of foster carers report that they regularly use their own money to pay for child-related expenses. And 60% of carers said that foster caring had negatively affected their levels of personal stress. And finally, that 40% of carers are either ambivalent or would not recommend foster caring to others. So let's tease this out a little to fully understand the implications of what these statistics are telling us. A majority of carers, nearly 60%, are paying for child-related expenses out of their own pocket. I know from speaking to carers that many of them give up on recouping the money because the process for getting the refunds is so convoluted and difficult to access. We hear from carers who've had to pay upfront for eye tests, glasses, school uniforms, dental, swimming lessons, and so on, and have either been denied a reimbursement outright or have had to wait so long that they've given up. This means, in effect, volunteer foster carers are subsidising the child protection budget. So how is this justifiable on any level? And it's perhaps worth noting that none of the carers wish to formally complain about this issue. They just want the system fixed. In many cases, it's not just about the money, it's about the principle. Carers are sick of being taken for granted, and I know from experience that at least some carers will voice their anger by quietly walking away. Rates of carer attrition increase every year, leaving the carers who are left behind stretched to breaking point, and some children being placed in hotel rooms or other alternative housing. And that's not good enough for our children. The need for reform of the funding arrangements that cover access to health, education, and recreational services is urgent and will remain a priority advocacy focus for the FCAV over the next year. The failure to invest in children and their carers is a false economy. We know from research that stable and well-supported carer households are better placed to deliver the best possible care. And that high quality care has a protective effect for all children, and particularly our vulnerable children. Furthermore, better supported carer households will produce more positive word of mouth about foster care. The carer census revealed that nearly 40% of foster carers are at best ambivalent or would not recommend foster care. This is a huge percentage and is likely to be contributing to the general shortage of carers at present. Poor word of mouth surely makes the task of recruiting and retaining carers much harder than it needs to be. While the government in its most recent budget has allocated millions of dollars to carer recruitment, they have failed to fix funding supports which would reduce carer churn and assist in retaining our current wonderful carers. This is clearly a profound funding crisis, which is playing out within the current pandemic crisis, a crisis within a crisis. When the Minister launched the carer strategy several years ago, he explicitly acknowledged the underfunding problem and promised to wear out the carpet between his and the Treasurer's office in his attempt to fix it. I fervently hope that in the next year that pile on the Parliamentary Acts Minister becomes threadbare. And I would like to hope that the Treasurer, Tim Pallas, is open to well thought out proposals for minimum funding levels to support carers. I think the signs are positive as the Treasurer has stated that the funding for the Homestretch program of support to 21 years of age was one of the things that he was most proud of from this year's state budget. When it comes to client funding, care allowance and system reform to better support carers and the children in their care, the case is absolutely compelling. Elvis probably says it best in his famous song, A Little Less Conversation. A little less conversation, a little more action, please. All this aggravation ain't satisfactioning me. A little more bite, a little less bark, a little less fight, and a little more spark. Close your mouth and open your heart. The time for action is now. Thank you. I'd now like to welcome the Honourable Luke Donnellan, Minister for Child Protection, Disability, Ageing and Carers, to say a few words. Thank you, Minister.
Okay, thanks, Anne. Thank you very much. Look, and it's great to join you today for the AGM, but really more than anything else, celebrating our carers and the great work they do. So, look, first and foremost, thank you for the work you do with the Foster Care Association, and I guess the push, always pushing, which is just so essential to, improve outcomes for children more than anything else, but also to support carers even better. I'd like to firstly acknowledge the lands upon which we stand, pay my respects to their elders past, present and emerging, acknowledge them as the longest living civilisation in the world, and how fortunate we are to be on their lands. And if Colin Hunter is still trying to get in, I'd like to acknowledge Colin, but I do know it's been very difficult for people in terms of IT in recent days. So I'll leave it at that. Look, happy Foster Care Week to everyone. Really for today is really more just about saying thank you very much and acknowledging what's been, as Sam was saying, an incredibly difficult year. All I could say is your capacity to adapt, your capacity to take on new challenges has really been tested over the last 18 plus months, whether it be homeschooling, keeping young people stimulated during an incredibly difficult period, and ensuring that their well-being, mental well-being is strong, along with, in many ways, trying to keep your own mental well-being strong. And that has not been easy. But in many ways, it's about acknowledging the enormous difference that you make to the lives of young people, and the fact that your heart and soul is in this, and that, I acknowledge that in many ways, there are some improvements we've made to support carers, but could we do a lot more? No doubt about that. And as Sam was saying, that's the work we're doing, whether it be through the surveys and so forth. But, the issues in terms of problems, in terms of supporting carers are well known, and they need to be addressed. And some of them will be addressed in the next budget. Some of them might not be. I can't promise anything today, but obviously, in terms of what I'd like to do, obviously, is to support carers better, and that a lot of it has to do with the costs in relation to supporting a young person. And I very much acknowledge that as a person presently who's actually doing pretty much the same thing with a young man, a friend of my son's, who's come to live with us. And it makes a substantial difference, but I can very much, I'm comfortable covering it. So, look, I could go on for hours and talk about different programs and so forth, and Carer Cafe and so forth. I won't do that. I just really wanted to say thank you and acknowledge what has been an incredibly difficult year for you and your people you're caring for. And I could talk for hours on it. I don't really think that, apart from just saying thank you very much. And I'll go in there to continue doing the work with Sam and others, with the Foster Care Association for you. Sometimes I'll fail, sometimes I'll succeed. Some bits I get, some bits I don't, but I'll keep pushing. So look, thank you for your continuing efforts, because it's no fun. It is the best and the worst of times. Yeah, it's a real pain in the bum, as sorry, Sam would say, and I don't like putting it that crudely and that simply, but I think if I was a little bit better read, I might have used similar terms. But thank you, and thanks for the marvellous work you're doing this year.
Thank you so much, Minister Donnellan. We certainly take heart from your words for both a brighter future and support for foster carers and the children that we have in our care. Thank you, Minister. It's now my absolute pleasure to introduce Dr. Karen Mclean. Karen is a paediatrician and leading researcher with the Murdoch Children's Research Institute. Some of you may have met Karen or spoken with her in a focus group in 2019, when she and her team conducted extensive research with foster and kinship carers in an Australian first study to quantify foster and kinship care experiences in accessing health services for children and young people in out-of-home care. Following this research, Dr. Mclean and her team have worked with stakeholders in the sector with the Centre for Excellence in Child and Family Welfare to establish a stakeholder reference group, of which the FCAV are part of, looking at the impact of COVID-19 on health and healthcare access for children and young people living with adversity, particularly those in out-of-home care. So we're really very pleased that Karen has accepted our invitation to speak today. And over to you, Karen. Thank you.
Thank you so much, Sam, and everyone, for the opportunity to speak today. It's such an honour to be here, and of course we'd all prefer to be in person, but as a doctor, let me say thank you to everyone for following the rules and supporting all the public health efforts to tackle this pandemic that we're all going through. I'd like to acknowledge that I'm on Wurundjeri land, and I pay my respects to elders past, present and emerging, and any Aboriginal people on the call today. Well, as Sam said, you might have met me in the last 9 years or so in the Pathway to Good Health clinic at the hospital or through the research. And working in this space, and particularly working in the clinic, has allowed me the privilege of meeting many young children and their carers and hearing their stories. And it's a job I really love because of the passion of those I get to work with and of the carers and, of course, the young people themselves. And we're all aiming for the same thing, ensuring the right support and the care so that children and young people can thrive. Now, that said, while I love my job, there's been a certain number of frustrations over the years. And I guess these systems that we work in, both health and child protection, they're pretty tricky systems to navigate. And over the years, I was meeting a number of children who really hadn't had their health needs assessed or attended to for some time, despite being in out-of-home care. And it was really that frustration with the systems that led me to begin my research and advocacy in this space. And because there was so little local research in this area, I really spent my PhD trying to gather the data to prove what I think we all suspected or kind of knew already. And so I'll share my key findings, but I don't think they'll really surprise you. So firstly, children in out-of-home care have really high rates of health needs across all domains of health. Almost all have some sort of physical health concern, but over half have developmental, behavioural or mental health concerns in each of those domains. And mental health concerns really rise with age. I don't think that's going to shock any of you. Secondly, we found that the children entering out-of-home care in Victoria were not consistently or routinely accessing the recommended health services. While almost all eventually get to the GP, only about a third did so in the recommended month. And less than 1% of children had seen all the recommended services, GP, paediatrician, audiology, dental and optometry within 12 months of entering care. And the main barriers to care, which we heard from you, the foster and kinship carers, included not enough publicly funded services with really long wait lists, particularly for paediatricians and mental health services. We heard that consent for medical care can be really complicated and that slows things down. And we heard about delays in getting Medicare numbers after a child enters your care. So over half of you had waited 3 months or more, and 1 in 8 had waited over a year for a Medicare card number. And that was clearly delaying access to healthcare. And these difficulties, as we've heard Sam talk about, often led you to pay for private services at your own cost. And as Sam referenced, the carer centres has echoed these findings and consolidated them, with lots of carers finding accessing Medicare numbers and other details are really a major challenge, and others commenting on the difficulties around consent. So as she mentioned, I'm now doing some research looking at the impact of COVID in this space. And we're about to launch a survey for 15 to 19-year-olds with an experience of out-of-home care. So look out for that if you're caring for someone in that age group. But my general observations would be, particularly as a healthcare worker, some of our COVID adaptability has been about this transition to telehealth and video appointments. I'm in the hospital right now. This is what I do on Fridays. And it's great for flexibility, and sometimes it's great for people not having to travel, and it's good for patients I know well, but it's not a great way to do a thorough assessment of children you've never met before. And we also very acutely know in paediatrics that we had a stretched mental health system before the pandemic, and these issues have increased and worsened with lockdown and social isolation, and we're really facing challenges in that space. But I just wanted to finish up today with 2 main messages, I guess. I think the time has really come for us to do more advocacy around timely access to appropriate healthcare for children and young people in out-of-home care, and to the Medicare numbers and the necessary things to support that. And I'm committed to working together in this space. And finally, just a massive thank you to you, to your families, to your networks, for opening your lives and your homes to children who need a safe home, whether it's a short time or a long time. Thank you for partnering with professionals in this space to go above and beyond and meeting their needs. And really, thank you for continuing to do this in times that have challenged and stretched everyone and exhausted everyone that bit more. So I'm really delighted that the Foster Care Association makes a fuss of you this week. Happy Foster Carers Week. You guys richly deserve some celebration. Thank you.
Thank you so much, Karen, and thank you also for the absolutely amazing work that you and your team are undertaking. Your work certainly echoes and provides an evidence base for what we hear and what is reported to us at the FCAV about a lot of those barriers, the difficulties that our carers and children are experiencing. So yeah, it's certainly our hope that your work translates into prevention, intervention, and improved operational practices. Thank you, Karen. Now, for many of us, our next speaker requires very little introduction. The Honourable Jennifer Coate, AO, is a former judge of the Family Court of Australia. She served as a commissioner on the 5-year Royal Commission into Institutional Responses to Child Sexual Abuse. Prior to this, she held a number of appointments, including Judge of the County Court of Victoria, State Coroner of Victoria, the inaugural President of the Children's Court of Victoria, Senior Magistrate of the Children's Court of Victoria, Magistrate and Deputy Chief Magistrate of the Magistrates Court of Victoria. Ms. Coate has also worked as a part-time Law Reform Commissioner, a solicitor in private practice, a solicitor for Legal Aid Commission of Victoria, and in policy and research for the Victorian Government. In 2019, she was awarded an Order of Australia and became an Officer of the Order of Australia. In 2020, Ms. Coate was reappointed as a part-time Law Reform Commissioner and Chair of the Victims of Crime Consultative Committee. And in July 2020, Ms. Coate was appointed to conduct an inquiry into Victoria's hotel quarantine program. Over to you, Ms. Coate.
Thank you. Thank you very much, Sam. Thank you for that introduction. And more importantly, thank you for giving me the opportunity to speak directly to you, the foster carers of Victoria, during Foster Care Week. I too acknowledge the country upon which I am speaking to you from, the beautiful Bunurong country, and I pay my respects to elders past, present and emerging, and particular respect and acknowledgement to any Aboriginal people online with us today. During my years as the head of the Children's Court of Victoria, I was regularly exposed to the work of foster carers. I've always endeavoured to convey the importance of the work of foster carers at the court and indeed to the broader system of child protection in Victoria. Quite frankly, the child protection system of Victoria could not function without foster carers. Carers that provide both short-term and long-term care, and of course episodic care as well, for those children in need of care and protection. The work of foster carers, as I've said, is simply fundamental to our system of child protection. You deserve nothing less than a full acknowledgement of this. And as Sam has so eloquently put today, that acknowledgement must be properly supported by the funding needed for you to carry out this role on behalf of children and young people, and indeed our society. The issue of funding to support the commitment made by foster carers deserves more than a cursory glance. This issue has been the subject of much advocacy and lobbying over all of the years that I can remember. In my view, amongst other things, it has been unnecessarily mired, bogged down and confused with the notion that the work that you do is altruistic and voluntary work. And therefore to, in inverted commas, pay carers changes the nature of that role. I know that much has been written and said about this. I want to say three things, make 3 points today about this issue. First, that the issue of funding should be looked at through the lens of the child. In other words, what does it cost to maintain a child in a caring, thoughtful, and appropriate home that provides the child with all the opportunities that that child needs to join in to the appropriate activities? This assessment must be done in the full knowledge that a number of the children coming into foster care will have special needs, all of which come with a cost on the household, as we've heard already, and I'm simply reinforcing that view. Second, what does the alternative cost in dollars, in emotional and psychological damage of not maintaining children and young people in appropriate care? And third, what has been the realistic and practical financial, not to mention emotional and psychological burden on children and young people in foster care, and in turn on the foster homes themselves that have to support children and young people in this current pandemic? I'm sure the association is very well placed to address these questions, and quite simply, they must be responded to properly by government on behalf of the children and young people who need these placements in the short term and in the long term. I also want to take this opportunity today to make a point about the importance of foster care to the building of resilience in children. We all know of the importance of resilience in our life's journey. That is, the ability to be able to cope with the range of stressors life is going to throw at most of us at some point along that journey. Many of the children and young people coming into foster care may have already faced considerable trauma and hardship and stressors in their young lives. The research tells us that the factors that enable children to develop resilience are both biological and environmental factors. Supportive relationships with adults and experiencing the warmth and affection of those supportive adults who are prepared to spend time with the child will contribute to the foundations of resilience in that child. In my professional life, I have seen the validity of this research play out time and time again. The child or young person who has felt the nurture and protection of a carer or supportive adult in their lives has often been able to better feel valued and therefore stand a better chance of developing self-esteem, a key component to resilience. I also want to say a word about the capacity of foster care to the building of a trusting relationship with a child, and in turn, the importance of that trusting relationship in the capacity to create a sense of protection for both children and young people. During my 5 years on the Royal Commission, I met in private sessions with hundreds of people who came to tell their personal stories of trauma, heartache, sadness, and abuse as children. For those who were abused in care, a significant proportion spoke about why they had felt unable to tell anyone about what was happening to them. Apart from not understanding what was happening to them, often not having the language to articulate or explain it, and fear of not being believed, high on the list of barriers to reporting was no one to talk to. I had no one to trust. I well remember the account of one young man who spoke of how he summoned up the courage to tell his foster father, after quite a short period in foster care, what was happening to him at school at the hands of a teacher. And the relief he felt was palpable, even some years later, when recounting his experience, after he was reassured by his foster father, he was believed and he would be protected. And indeed, that's what happened. Over my years of involvement in the child protection system, as I said at the outset, I regularly heard foster carers express frustration at the apparent devaluing of their role in children's lives. And this included issues such as what they had to offer by way of evidence as to a child's well-being and indeed what might be a child's best interests. I heard, understood and accepted this frustration. What I did not do, as it was not appropriate, was step out of my professional role at that time and speak of my own family history. Today, in retirement, away from the daily requirements of judging each matter on the evidence before me, it's a different moment for me. I know that the evidence of one, and personal evidence at that, is not validated research, but nevertheless, I'm going to give you some evidence about my own personal experience outside the realm of my professional experience. My own mother was raised in foster care. My mother was relinquished as an infant and placed into an orphanage in 1915 at the age of 3. She was placed with a foster mother who cared for and nurtured my mother into her teenage years. That foster mother was in her early 60s when she took my mother into her care and looked after her and developed her up into the strong, courageous, loving, resilient, compassionate, life-loving woman that was my mother. My mother experienced considerable personal grief, loss, hardship, and illness in her life, and yet her capacity to deal with these adversities was simply second to none. I know that the reason my mother was able to feel and show love and empathy was that she experienced that love and reassurance of her worth from her foster mother. She told me so. My mother's strong commitment all her life to our individual and social responsibilities to care for and look after those less fortunate than ourselves was modelled to her by her foster mother. In turn, as the daughter of a mother raised by a foster parent, I reaped the benefit of being brought up by a loving, stable and committed parent. My mother played a vital role in modelling empathy for others to me. Unfortunately, I did not get a chance to meet and know the woman that shaped my mother, as she was long gone by the time I arrived into the world. But had I met her, I would have been able to express my deepest admiration and thanks to her for looking after my mother and raising up the woman that raised me. I did not ever get that opportunity. But today I have the opportunity to say to you as foster carers, I know what you do. I deeply value the work that you do, and I admire with all my heart your commitment to the children and young people that you care for. And thank you for the work you've done, and I know you will continue to do. Thanks, Sam.
Wow, feeling a bit emotional. Probably all need a moment to reflect on what incredible and powerful words they were. I must say what a privilege it has been for you to share your personal journey with us. And it certainly reminds us of that the care that we provide today does indeed shape the way that our children become community members across generations. Your personal experience shows that foster carers can instill such a strong work ethic and sense of community, like your own mother demonstrated with her care experience, which went on to inform the way that she parented one of Australia's greatest legal minds. In your highly distinguished legal career has been underpinned always by a passionate commitment to advocating for children and the rights of families, and your humanity and your compassion just always shines through. Thank you so much.
Thank you, Sam. Thank you to everybody, and I feel so honoured to have been able to participate in these Foster Care Week acknowledgement and celebrations. And thank you so much to everybody out there for the work that you do. Thanks, Sam.
Thank you. Okay, I'll now hand over to the President of our Foster Care Association, Tori Smith, to say a few words and to conduct the formal part of our proceedings with our annual general meeting. And please do stay on, because after our annual general meeting, we will conclude with our Special Agency Worker Awards. Thank you, Tori, and over to you.
Thanks, Sam. What an incredible place to pick up the baton. I can't believe I need to follow on from that. Thank you so much to the Honourable Jennifer Coate. I'd like to officially open the annual general meeting component of today's gathering. As Sam said, please bear with us. We'll keep this part of proceedings to be as brief as possible and then continue with our awards. I'm joining our meeting today from the traditional lands of the Wurundjeri people, and I wish to acknowledge them as traditional owners. I'd also like to pay my respects to the elders, past, present, emerging, as well as paying respect to Aboriginal people, their elders, past, present and emerging, from each of the communities and traditional lands across which we're spread today. We have just one official apology today, and that is from Luke Rumbold, CEO of Upper Murray Family Care. Ahead of today's proceedings, FCAV members were sent information packs containing the minutes from last year's AGM, the annual reports and the financials. I'd like to remind everyone that only full members can vote when requested today, and only full members who attended last year's AGM can vote on accepting the minutes. In order to vote, you will see a voting panel on your screen when we get to that. So assuming that people have received those information packs and that people have had a chance to look over those documents, I now move that the minutes of last year's AGM be accepted. May I have a second for that, please? Thank you, Luke. Okay. I now invite full members who attended last year's AGM to vote now with the panel on your screen to accept the minutes from last year's AGM. Just while you're doing that voting, I'll take the opportunity to announce the results of the board elections. We received 2 nominations and have sufficient vacancies on the board in order to accept both of those unopposed. Therefore, I'd like to congratulate Luke Sapwell as a returning board member and Matthew Fredericks as a newly appointed member who will be confirmed at the October board meeting. Okay, so I've just had it confirmed that we've had enough votes in now to accept last year's minutes. Thank you very much. And we will move now to accepting the annual report and financials. As I mentioned earlier, the annual report was sent to members ahead of the meeting, and you will see a new voting panel appearing on your screen. Firstly, I'll ask that a motion be passed and seconded to adopt the annual report and financials.
Thanks, Tori. I will move the motion that the annual general meeting of the FCAV and the 2020-2021 financials are accepted.
Thanks, Sue. And seconded. Thank you, Luke. Okay, the voting panel will remain on your screen throughout my President's report and throughout Zoe's Treasurer's report. You can vote at any time if you've reviewed the material, but a reminder that you must be a full FCAV member to vote. It's been a great privilege for me to act as President of the Board for the FCAV this year. For those of you who know me, you know that I could talk about foster care all day, but I won't do that. I will keep my comments brief. This year's theme for our celebration is adaptability, caring through COVID. With that in mind, I'd really like to start by just acknowledging the work of many people through these challenging times. Firstly, and with the theme of today, obviously, thank you to all of our carers and members of FCAV who have been continuing to care for children and young people throughout all the challenges of COVID, tackling the additional challenges, whether it be schooling from home or contact with family via Skype or whatever it is, and often with reduced access to supports at this time as well. I want to thank all of the FCAV staff who have continued to provide high quality phone support through the information carer support line, providing therapeutic support for carers, running online training sessions, facilitating access to the National Foster and Kinship Conference, advocating around system issues with department and agencies, sending out our regular newsletters, producing webinars, keeping everyone up to date through social media, coordinating events such as this one, keeping our finances in order, ensuring that we stay true to our reconciliation action plan, and keeping the office running, even during an office move this year. The staff have done this all without skipping a beat as they've worked from home, the office, etc., often juggling their own family and household commitments like everyone else in the state. A special thank you to Sam Hauge for her oversight of all of the above. It's just such a blessing to have a very strong CEO who is able to just keep things on track, and we have great faith in her all the time. Thank you too to the members of the board for volunteering the many hours they do to the governance of all things FCAV. Celebrations such as today's give us a chance to step back for a moment and reflect that despite the challenges carers have faced, particularly over the last 18 months, I think there's reason for great hope. Every day, our members provide hands-on care for approximately 1,600 children and young people. It's difficult to think of a more vulnerable group of children than those removed from their families for their own protection. Whilst we wish our role was redundant, foster carers step up when no appropriate family members are able to take on the care of these kids. Through every interaction in the minutiae of daily life, you nurture the kids in your care, providing an alternative life experience of safety, predictability, health, education opportunities. Whether kids move on quickly or stay with you for years, these experiences stay with them, and they will always have the knowledge of that other way of life and the memories of a time when they were valued and protected. In that way, just as the Honourable Jennifer Coate described regarding her mother, the kids you care for today can go on and make choices about how they live as adults and what they may pass on to future generations. And in that, there is great hope. There's also great hope when carers join together in advocacy, because we can achieve meaningful changes. Just in the last year, we've had Homestretch, the care for young people in the system up to 21 years, made universally available to all young people in care. Ongoing funding is now guaranteed for our Carer Cafe to offer training to all carers. We've established the Care Assistance Program, offering free therapeutic support specifically oriented to carers. There's been improved processes being implemented around birth registrations for children in care. These are all meaningful changes. They're not enough, but they are meaningful. And the FCAV is committed to continue advocating for carers, including a focus on adequate reimbursements so that carers aren't paying for the privilege of being a carer. A greater focus on the retention of carers so they can feel valued, respected and empowered to continue caring, and in turn, inspire others to become carers so that the needs of all children requiring care can be met. And we'd also like to see funding and resources that will enable the state's carer strategy to be fully realised. These are just a few of the things on our agenda. But I won't continue talking today. I'll hand over quickly to our Treasurer, Zoe Sredovic, for her report on the financials before we finalise our voting. Thank you, Zoe.
Thank you, Tori. And hi, everyone. I'm Zoe Sredovic, and I'm the Treasurer of the Foster Care Association. And today I'll take a few minutes of your time to step you through our financial results for the year ending June 2021. So for the fiscal year, the Foster Care Association of Victoria ended the year with net assets of $266,812, which is an increase of $36,000 from the previous year. Our total income was just over $1.7 million, with funding provided by the Department of Family, Fairness and Housing of $1.6 million and other income of $153,000 from our carer subscriptions, donations and fundraising activities. This income was allocated to support our carer information and support services, our advocacy and memberships, our carer assistance program, and the Carer Cafe program, which provides learning and development opportunities for our carers. During this year, COVID-19 lockdowns restricted our ability to deliver face-to-face program activity. Despite this, the Department of Family, Fairness and Housing continued to provide the grant funding, and as a result, $816,000 in additional funding will be set aside for the Carer Cafe program in the next fiscal year. Expenditure for the year was $1.7 million, and was 8% lower than the previous year. The decrease is primarily due to the COVID-19 impacted expenditures relating to the delivery of learning and development programs for carers. The operational expenditure, on the other hand, increased due to an appointment of an in-house finance manager, a fundraising officer, as well as office relocation costs. Finance plays an important role in partnering with management and staff to identify opportunities and create efficiencies. And I'll take the opportunity to thank our finance manager, Jennifer Williamson, for her support and hard work. FCAV works diligently to deliver high quality services to our carers. And on behalf of the board, I'd like to thank our foster carers for their commitment to making a difference to the lives of young people, the Department of Family Fairness and Housing, and our donors for their support. And I'd like to thank our staff for their hard work and their ability to be flexible, adaptable, and stay committed during these unprecedented times. My kind regards and best wishes to you all. Thank you.
Thank you, Zoe. I'll just give a final couple of seconds for you to finalise your votes. Please submit your response now if you haven't already. And I can confirm that we do now have sufficient votes that have been received, and the annual report and financials have been accepted. That signals the end of our official AGM. However, we will return now to the rest of our celebration and to the awards. Thanks, Sam.
Thank you very much, Tori, and thank you, Zoe. And just a really quick shout out to all of our amazing and dedicated board members who give up their time and provide us with their expertise to guide us really in the right direction and ensure really good corporate governance at all times. So thank you. And my heartfelt gratitude also extends to the FCAV staff who have continued to work relentlessly and flexibly to provide carers with information, support and advocacy, whilst at the same time providing learning and development opportunities and forums throughout the year. You're an absolutely fantastic crew, and it's always a privilege to work with you all. And now to the last segment, which is something new and exciting for the FCAV. We're really pleased this year to have inaugurated the Commitment to Supporting Carers Award. We recognise that the support offered to carers is really golden in a complex system, especially in these challenging times. So we sought to give foster carers the opportunity to acknowledge people who have offered committed support and to show how much that support means to them in caring for their children and young people. So we invited foster carers to nominate a worker to acknowledge an instance of when they'd received above and beyond support in the lives of their children and young people in care. We were really gratified and quite overwhelmed actually to receive 70 nominations from you for agency staff who'd gone out of their way to provide you with excellent support. So congratulations to all 70 nominees, and your support to carers is greatly appreciated. Every nominee will receive a certificate from us to recognise your commitment to foster care, and thank you for all nominations. But our selection panel had the really difficult task of narrowing that 70 down to seven finalists. So congratulations in no alphabetical order go to Lenny Burt, Lighthouse Foundation, Jacintha Condolac, VACA, Jennifer Coverdale, Uniting, Madison Kelly, MacKillop, Sarah Martin, Bowen Child Youth and Family, Beth Matthews, Anglicare, and Adele Silva, Life Without Barriers. And now the drum roll. It's my pleasure to announce that the two winners are Sarah Martin of Bowen Child Youth and Family and Beth Matthews of Anglicare West. Sarah's nominee, foster carer, said that Sarah always ensured the best interests of the children in the care were upheld and that they as carers were supported. Sarah checked in at least weekly, but at times would communicate many times a week. They knew they could always call or email her and were never made to feel that it was an impost. It always felt like they were working in unison for the best outcomes for children. Absolutely outstanding support, and again, congratulations, Sarah, well done. And to Beth Matthews, who actually received two separate nominations, which is in itself a testament to her consistent support. One of the nominators said that Beth is their shining star on a daily basis. She shows up for them and for the children in their care, time and time again. They always feel like their voice as a carer is heard and everything is run past them before decisions are made. She is their loudest cheerleader in the good times and their strongest supporter during the difficult times. And the other nomination shared a very pointed testament to Beth's work, that the child that was in their care has now since turned 18 years old and has started studying to be a youth worker. They believe that he was inspired and supported by Beth and saw how great Beth was in supporting them. Just absolutely exemplary support, Beth, and congratulations. So thank you to all our nominees, finalists and our winners this year. And really many thanks to all of you foster carers who took the time to nominate and for all the work that you do. And regardless of the selections today, we know that anyone striving to provide the best possible support to children in their care and young people in the home-based care sector is an absolute winner. And really that brings me to the big congratulations and thank you. Thank you to all of our carers. Awards should always be going to you, the foster carers who every day and every night work tirelessly to provide a safe and nurturing home for the children and young people in your care. We absolutely value, absolutely respect you for everything that you all do year round, and hope to see you really soon at an event in person in the coming months. And thank you to all the attendees who have joined us today, our supporters, our sector colleagues, and especially our foster carers. Next year is actually the FCAV's 30th year anniversary. So our carer celebration promises to be a really big one there, and hopefully a big party time. I'm sure we'll all be able to join in person at that stage. But for now, stay well and take care of yourselves and those beautiful children, young people that you have in your care. Foster carers really are the hidden heroes in our community, and yeah, your commitment is absolutely phenomenal. Thank you, everybody. Thanks.